This is Eric Haley and Mike Weaver from Max Fitness LLC in Mount Laurel, New Jersey. And we're talking again about this patellar tendon rupture surgery. This is week 3. Tomorrow will be week 3 since the surgery. A lot has happened, a lot of progress in this past week. So we have Mike here. Mike has a lot of questions, and we're going to answer some questions. And again, this is my journey. This is, I'm going through this to hopefully help other people going through, whether it's this injury, another injury, or it could be, any struggle that you're going through. Again, hit us up. We're willing to message with everybody. We want to talk to people. We want to help as many people as possible. And even making these videos is even helping me out, because I might have a setback, or I might feel like like getting frustrated, and then I look back to like my first video from week 1, and I'm like, okay, I've come a long way. Like, this is good.
So one of the things that I've noticed is last week I left Thursday night. I think the last time I saw you was Thursday, right? And I totally remember the place that you were in Thursday, right? I didn't see you Friday, Saturday, Sunday, and came in Monday, and you were almost in a completely different place, right?
Yeah.
It may have been the following week, I think, but regardless, I had taken just a short 4 days of not seeing Eric, and I was and I keep saying I couldn't believe it, but with the way that he's been thinking about this whole situation, I kind of could believe that he made that much progress. But what I found interesting, and what I wanted to learn a little bit more about was how did you get there so far? How did you get what seems to be so far ahead so quick?
I think the biggest thing, I'm still doing the plant nutrients, water, just focus on what I'm putting in my body.
The basic foundational.
The foundation of that.
Things, right?
It is, a lot of it's the mentality, my mind is so zoomed in on this knee. It's the first thing I think about in the morning. It's the last thing I think about before I go to bed. And I just make goals every single day. I want to do something I couldn't do the day before. And you have to, be almost obsessed with wanting to get better. This is not me. This is not where I want to be. I have a goal where I want to be. So every day I'm doing my therapy, not only where I'm going to Ivy Rehab, but I am, I'm allowed to do my therapy, they say 3 times a day. So throughout the whole day, I'm doing something, trying to get stronger, trying to get comfortable with certain positions. So it's, if you go 3 days without seeing me, within those 3 days, I am constantly trying to do something to get better.
How were your last few therapy sessions?
They were awesome. Brant's really cool. He's really, looking at who I am as an individual. And there's certain things that I've been working on. So next time I go in there, he's always oh, well, that's awesome. Now let's try this. And he's always trying to push me to the next level, the next, the next progression of what I've been doing before that. So
it's cool to see that they're treating you as a specific patient, right? So you've been talking a lot this week about the difference in where your end result may be compared to somebody else's end result. And it seems his name's Brant at Ivy. Brant is really honing in on you as an individual, and I'm sure he's doing the same for his other clients.
Yes.
Right?
Yeah, so my end result, so if this is anywhere from 6 to 9 month recovery. So within that 6 to 9 month, my end result might be different than somebody else's. So my end result, I want to be an athlete again, be able to play sports, be able to squat, deadlift, lunge, jump, sprint. I want to be able to do all these things. So for my goal, the 6 to 9 months, all right, is to be able to go and be able to do those things. Very dynamic, things that take a lot of strength, balance, agility, all these things. So if somebody else's goal might be to be able to do everyday things like walk, sit down comfortably, drive, and all this. They might not have to be able to do the things that I'm doing
But
at 3 weeks.
And like, their goals may not be the same.
It might not,
right?
they don't
So
want to have to do that.
that's why, like, when you look at Eric, you know, or, you know, you look as specific as Eric's injury, you know, just because, you know, you're not Eric or you don't have the same injury as Eric does not mean that, like, this process that he's going through isn't relatable, right? Because there's still, you know, the concept that he's adopted as far as, you know, growth every day, getting better every day, having goals every day, right? So just because they're not exactly the same does not mean that it, you know, it can't be relatable. So I think that's, you know, I just think that's really important, you know. So yeah, that, you know, that's just a little bit of just making sure that everybody understands that, you know, just because it's not the same, that it's not relatable. So I think we wanted to kind of either take a quick look at, you know, a couple of the PT sessions this week, last week as well, and just kind of explain a little bit of, you know, what you had going on, some of the progress you're making, and, you know, how Brent's, you know, working with you pretty closely.
Yeah, what I'm going to show is, like, I was doing some of the exercises that I've been doing in PT, and mixed with a few, like, upper body exercises just to try to keep myself in shape. So here it is.
20 shy. Keep your foot turned in.
I'm only kidding with you, Eric.
Alright, so that was a little bit of what I've been doing. Again, like, I have permission through my therapist right now to be able to do some of these things. I'm safe right now because I have the immobilizer on, so, like, I'm not able to bend my knee and everything. Pretty protected. It seems like I'm doing a lot, but, you know, if I took this off, it'd be, I mean, it's like a mess. There's still a process that has to go on. But he's trusting me. He sees that I can do certain things, so he's allowing me to progress to certain things that, you know, I mean, maybe some people can do more, maybe some people do less, but, like, he sees what I can do, and he's allowing me to do certain things. But yeah, like, I'm doing really well. I still have a long journey to go to be able to do the things that I want to do. But, like, yeah, so, like, the last video, like, certain things that are, like, very exciting for me, like, last video I still had to take my leg to, like, go up and down on the table, you know, where, like, now I can just, you know, just freely use my leg. I have the strength in it, you know, which is pretty cool. The walking's getting easier. The balance, like, I can, you know, stay on this leg and just, you know, do whatever I have to do, like for all.
Well, that was the biggest thing from, like I was talking about earlier, there were, you know, just a short 4 days when I didn't see you, and then you walked into class the other day, and, you know.
Stand up the whole time.
Yeah, he's doing this, and I was blown away by the progress he had made simply because every single day he's setting
Trying to do
goals.
something
And
else.
yeah, exactly. So I think the video we just looked at was a few days ago, right, where you know, you got a nice little workout in. You were doing some of the PT exercises that Brent had showed you, and today you had another appointment with him, right?
Yeah. So last week I said I was at like 40 degrees flexion, and today I was at like 88 degrees.
Okay.
You know, so that's a nice jump. But they want me to do like 5 to 10 degrees increase every week, so that's adding another 48 degrees in a week. So that's pretty cool.
Yeah, it's not bad, right? Do you have a video from that today?
I don't have a video of that one.
Okay, so then let's like take a look at, so they were saying they want 4 degrees a week,
They want 5 to 10 degrees per week.
5 to 10, and you went 40, so like, where is the difference in that, if you wanna just?
Some of us at 90
show?
degrees.
So like, where were you last week?
Last week I was about there.
And where would be 5 to 10?
So they want every week to be boop, be like this.
Okay, and you went from where
I
to where?
went from about like right here to like here. Sure. It's like 90 degrees.
Yeah, so, I mean, you can
almost there.
see the difference in the, the deflection in his leg and his knee, right? So I think that's just like a testament to, if you, really focus in and hone in on every single day what you need to do in order to get better, there's a good chance that you're not only going to, you're not only gonna, meet the goals, but there's always a chance that you could exceed them, right? So
Yeah, I wanted to get 10 degrees better. That was my thing.
Sure.
So being able to do that, thank God. But yeah, like you just said, it's about exceeding your goals. Like sometimes you want to meet something and exceed it. So like my goal throughout this whole process was to be better than I was before I got hurt.
Mhm.
And like it's still gonna be my goal. I want to do it, and I'm going to do it.
Yeah. What do you think about like, and how do you handle, because I'm sure there are those, you say it's the first thing you think about when you wake up, right? What about like setbacks? Like how do you handle, what if you got there and you couldn't do, 5 more degrees? Like how do, what's your, what are you thinking about there?
So I've had certain things that I've tried to do and I wasn't able to do it. A big thing that I was able to do this week is sit in the front seat of a car. It sounds crazy, but having my leg extended and being in pain, I've been sitting in the back, leg extended out to the side. So being able to do that was a big deal. And now I'm sitting in the front seat. But I've made those attempts before that. I'm like, okay, I'm gonna sit in the front today, and I would try to get in the car. My wife's trying to help me, and then I couldn't do it.
How'd you like stay along that path? It's very easy to get
It's very easy
frustrated
to get
there,
frustrated.
right?
So what I do is, I'm down on myself. I'm human, so I'm going to be down on myself. I would say I'm kicking myself, but I can't kick. But like you get down on yourself. Then I have to like sit down and thank God for my wife and everybody to like calm me down. But then I just sit there and I think about how far I've come. Like you could sit there and think about that moment and where you want to be and you're not there, or you could sit there and think about how far you've come. And then so what you have to do in a situation when you're not where you want to be, think about how far you've come. Always think about that in any situation.
I think you said earlier, before we started here, that, in those moments, it was cool to look back on your first video, right?
Yes. Yeah, this video has really helped me. And that's what I want to do for everybody else is you can look at if you're going through something, look at somebody who's been there and see that they're being positive, and then look at where they are a couple of weeks after that, and that they have some progress. They're not in that same situation anymore.
Sure.
So even for me, I'm gonna go back. Sometimes I go back and look at that first video, my legs sitting up there, wrapped up.
I think the crutches were sitting right
Crutches
there
are
too.
sitting there. I'm taking that band, trying to move myself with the band. I'm telling you, even be able to do this, freely.
It's a big deal.
It's a big deal for me.
For sure. Yeah, so.
So thank you everybody for tuning in, and again, reach out to us for anything, and thank you for watching the videos, and thank you for all of your support, and thank you, Mike.
For sure. Appreciate you guys. Thank you.
Thank you.